So before we proceed with talking about the muscles, the proper muscles of the upper limb, let's have a brief review about the joints that we can see within the upper extremity. So here in the slide, I've summarized the names of the joints and what type they are. So let's begin with the first one. So here we have your SC joint, which stands for sternoclavicular joint. So it's this joint here, the connection or the articulation between your sternum and your clavicle. So this type of joint, your sternoclavicular joint, is a type of double plane joint or a saddle joint. So there can be movements of elevation, there can be movements of depression, there can also be axial rotation, in wherein your clavicle rotates on its own long axis. The next joint we have is your AC joint, or also known as your acromioclavicular joint. So this is the joint formed here by the acromion process of your scapula and the lateral end of your clavicle. So your AC joint is a type of plane joint, only allowing gliding or sliding movements to occur within this joint. Our next joint here is your GH joint. So this is your glenohumeral joint. So this is essentially what we refer to when we talk about the shoulder joint. Okay, so GH is synonymous with your shoulder joint. So this is your GH joint formed by the articulation between the glenoid cavity or fossa of your scapula and with the humeral head. This forms a ball and socket joint, allowing for a greater degree of motion. So there can be flexion, extension, abduction, adduction, external or lateral rotation, as well as internal or medial rotation. So a lot of movements occur within your shoulder joint, essentially contributing to a lot of the movements being available to the upper extremity. And lastly, here we have your ST joint. So this stands for your scapulothoracic joint. So this is the joint formed between your scapula here at the back, so posteriorly, and with essentially the posterior thorax. Okay, so the type of joint that your scapulothoracic joint is actually called a functional, a pseudo, or a false joint. Because technically, when you're talking about joints, this means articulation between two bones. When when we see the scapula attaching on the posterior thorax, it's not actually a bony articulation. So the question is, what attaches now your scapula to your posterior thorax? So it's actually muscle. It's actually muscle that attaches posterior, your scapula to the posterior thorax, and that's why it's considered to be a functional or a false joint. It's a joint in the sense that it allows movement to occur between a bone, right, and your essentially your posterior thorax. But in another sense, it's not a real joint or an actual joint because it's not purely bony articulation. So there's a bit or a lot of layers actually of muscles in between these two bones. So in general, all these joints make up what we call your shoulder. So SH is short for shoulder. Make up your shoulder complex. Okay, so when you see books mentioning things about your shoulder complex, it's usually referring to all of these or one of these joints. Okay, so when we're talking about the shoulder complex, it's usually all these joints that are individual yet they are connected. So let's say something happens to your sternoclavicular joint that limits the motion of this specific joint only. So essentially, it could lead to problems or limitation of motion with all of the other joints. So affectation of one joint can affect all the other joints within the shoulder complex. So that's again your shoulder complex. It's your sternoclavicular joint, your acromioclavicular joint, your glenohumeral joint, and your scapulothoracic joint. And there's also another terminology that I'd like to discuss. So we've already talked about your shoulder complex, your shoulder joint. So when you're saying the shoulder joint, that's specifically referring to your glenohumeral joint, which is this joint over here. The last one I'd like to mention is your shoulder girdle. So let's write that down. You have your shoulder girdle. Okay, so essentially, what a girdle is something that encloses, anything. So, like for example, in women wear girdles underneath their clothes, especially to bind their abdomen so that it appears smaller. Okay, so I think most of us are familiar with these types of girdles. So in this case, when we're talking about anatomy, especially with the upper limb, we have what you call a shoulder girdle. So when we're talking about the shoulder girdle in the context of your upper extremity, so this is talking about all these joints making up or surrounding the upper thorax. So the joints that comprise your shoulder girdle, you have your sternoclavicular joints. Okay, so these close the girdle anteriorly. What else? You have your AC joint, your acromioclavicular joint. You also have your scapulothoracic joint. Okay, so the joints that make up your shoulder girdle are your scapulothoracic, your acromioclavicular, and your scapulothoracic. So again, that's sternoclavicular, acromioclavicular, and scapulothoracic joint. So this is excluding your GH joint. Okay, so tatlo ka joints making up your shoulder girdle. Now the question is, what closes the girdle posteriorly? Okay, so because we know now that your scapula does not attach directly to your posterior thorax. That's right. So instead of having bone closing the shoulder girdle posteriorly, it's muscle that closes it posteriorly. So when we let's try to draw it superiorly or from a bird's eye view. So if this were your sternum, you'd have your clavicle here, right? Then posteriorly you have your scapula. This is your scapula, let's say. Okay. And this is your vertebra, for example. Okay, so there's a bit of the distance between the scapula and your vertebra. So what closes the girdle posteriorly again are different or various sets of muscles. So this is what makes up your shoulder girdle. And another purpose of the girdle is that it serves as an attachment point for your appendicular skeleton within your axial skeleton. So that's why the GH joint is excluded, because it's the one that needs to attach to your girdle. Okay, so I hope this is clear regarding the joints. So now we can proceed with the muscles of your upper extremity. So now let's discuss the first group of muscle. You have your pectoralis major, your pectoralis minor, your subclavius muscle, and your serratus anterior. These are muscles connecting the upper X essentially to your thoracic wall. So the first muscle we have here is your pectoralis major. Okay, so from previous discussions about the naming of muscles, we can tell from its name that this is a big muscle, right? Because of the word major. This is a big muscle found on the pectoral area, or essentially the chest area. So now let's talk about specifically what your pectoralis major muscle is all about. You have its origin here, which is the clavicle. Okay, it's originating or starting from your clavicle, from your sternum, okay, and the upper 6 costal cartilages. So when you say costal cartilages, these are the cartilages from your sternum and connecting it to your ribs. Okay, so you have the upper 6 one. Okay, so again, it's from your clavicle, your sternum, and your upper 6 costal cartilages, and it inserts within the lateral lip of the bicipital groove of the humerus. Okay, so let's try to draw your proximal humerus. You have the head over here, and then you have your greater and your lesser tubercles or tuberosities over here. In between your tubercles is what we call your intertubercular groove. So the borders of the bicipital groove or the intertubercular groove are what you call its lips. So it has two lips, it has a medial lip and a lateral lip. So that's just saying that you have a medial border of your bicipital groove. The medial border here near the head is also known as your medial lip. And you have here the lateral border or the lateral edge of your bicipital groove is known as your lateral lip. Okay, so these are the specific lips of your bicipital groove. So your pectoralis major muscle attaches to or inserts to your lateral lip of the bicipital groove of the humerus. So essentially speaking, that's a bit just a bit lateral to the aspect of the humerus. Okay, so this is the origin and the insertion of your pectoralis major. So again, when we're talking about muscles, it's usually the origin pulling on the insertion. So if you fill up the entirety of your pectoralis major muscle, right, as it inserts here to the lateral lip of the bicipital groove. Okay, so we can see clearly your pectoralis major muscle. When the origin pulls on the insertion, what movements do you think can occur? So since it has attachment sites with your humerus, it crosses your shoulder joint. This means, kumbaga, gintabok niya si shoulder joint, so it can move your shoulder joint in that sense. So the movements that can occur are, of course, you have adduction of the arm or adduction of the shoulder. Okay, so this is movement going towards here. You also have rotation, internal rotation, which makes sense because it attaches to the lateral side of your humerus. Therefore, when the origin pulls on it, it can rotate your humerus inwardly. And lastly, you have a bit of flexion, right? Since some parts of your pectoralis major have origins with your clavicle. So from the clavicle to your humerus, there's a bit of flexion power with your pectoralis major muscle. And lastly, you have your nerve supply. So the nerve supply of your pectoralis major muscle comes from your medial and lateral pectoral nerves from your brachial plexus. So more of the brachial plexus, which is the origin of all of the nerves for your upper extremity, will be discussed further with your lecture. So let's just move on to the next muscles. So this is your pectoralis major muscle, which has origins with your clavicle, with your sternum, right, and with your upper 6 costal cartilages. So this is cartilage 1, 2, 3, 4, 5, and 6. And it inserts on the lateral lip of your bicipital groove or the lateral lip of your intertubercular groove. And this is the entirety of your pectoralis major muscle. So when the origin pulls on the insertion, there are three movements basically of your pectoralis major muscle. Let's draw it here. You can have adduction this way of your shoulder joint. What else? You can have internal rotation of your shoulder joint. And lastly, there's a bit of flexion that can happen. So these are the three movements of your pectoralis major muscle. And your pectoralis major muscle, again, is innervated by your medial and lateral pectoral nerves. The next muscle we have is your pectoralis minor. So here is your pectoralis minor. It has an origin, or it starts from your third to fifth ribs. Its insertion is on the coracoid process of your scapula, which is found on the anterior aspect of the scapula. Its action is to depress the point of the shoulder, and if the scapula is fixed, it elevates the ribs of origin. So usually when you're talking about muscles, it's usually the origin pulling on the insertion, right? So if that were the case with your pectoralis minor originating with your ribs, this is the origin, and inserting on your coracoid process, when the origin pulls on the insertion, what could happen is that the point of the scapula, where with your coracoid process, can be depressed by the pull of the pectoralis minor. That's one way that the action of the pectoralis minor can happen. Another way is that your pectoralis minor can actually have reverse function. So instead of the origin pulling on the insertion, it can be the insertion pulling on the origin. So when that occurs, what happens is that your ribs will elevate. So partly this assists with a bit of function of breathing, with forced breathing, especially for example like when you're hyperventilating, right? So when you breathe a little bit harder, your ribs start to need to elevate a bit to assist you to get more air to your lungs. So that's essentially one of the factors that can cause the this switch in function of your pectoralis minor. So for innervation of your pectoralis minor, you have your medial pectoral nerve. So this is your pectoralis minor muscle with origins from your third, fourth, and fifth rib, and it inserts within your coracoid process. So this is the entirety of your pectoralis minor muscle, so it can move two ways. Your pectoralis minor origin can pull on the insertion, causing depression of that specific part of the scapula, and at the same time, sometimes there's certain scenarios in which this switches. So instead of the origin of the ribs pulling on the coracoid process or the insertion can pull on the ribs, therefore causing your ribs, your third to fifth ribs specifically, to be elevated. So one thing that this can help with is with forceful breathing, like when you're hyperventilating, for example, to allow a bit more air to get into your lungs. So this is your pectoralis minor muscle. The next muscle we have is your subclavius muscle. So just looking at its name, we know that it's sub, meaning under, clavius pertains to your clavicle. So this is a muscle that is found underneath your clavicle. So for the origin, insertion, action, and innervation, you have its origins from the first rib as it inserts with your clavicle. Next, its action is to depress your clavicle, so to pull down on the clavicle, or to steady the clavicle with movements of the shoulder joint. Remember, your shoulder joint is part of your shoulder complex. So movement in one joint affects all the joints within the shoulder complex, right? So the clavicle, for example, when you're elevating your arm, when you're flexing your shoulder, when you're flexing your shoulder, there's a bit of rotation happening within the clavicle. So that can improve the range of motion of your shoulder joint. Okay, so if movement of your clavicle is not controlled, right, or is not controlled by a muscle like your subclavius muscle, so the role of the subclavius muscle is to steady your clavicle with movements of your shoulder complex or your shoulder girdle. So without your subclavius muscle steadying your clavicle, so excess movements can occur, and that won't be good for your shoulder complex as well. Okay, so again, the job of the subclavius is to depress or pull down on the clavicle, or to steady your clavicle with movements of the other joints within your shoulder girdle or shoulder complex. So there's a specific nerve innervating your subclavius, and that is the nerve to the subclavius. So that's very easy to remember. So here is your subclavius muscle. Your subclavius muscle has origins with your first rib, and it inserts very close in proximity to your clavicle. So it originates here, and it inserts right over here. So the action of your subclavius muscle is to pull on or depress your clavicle, as well as to allow for stability of your clavicle with movements to the other joints of your shoulder girdle as well. So the nerve that innervates your subclavius muscle is a specific nerve called your nerve to the subclavius. The next muscle we have on our list is your serratus anterior. So your serratus anterior, a bit of additional trivia, is also known as the boxer's muscle. And this is because this is very hypertrophied or very visible in a lot of boxers, because as we go on, you'd know that its function is all about scapular protraction, which is included in the movement of punching forward. Okay, so here's your serratus anterior muscle. Its origin is from the upper 8 ribs. Okay, so essentially this is more on at the lateral aspects of your ribs. Okay, what else? So its insertion is with the medial border and inferior angle of the scapula. So your serratus anterior starts off anteriorly with your ribs. It starts off here anteriorly with your ribs, right? Especially your upper 8 ribs. So it's 1, 2, 3, 4, 5, 6, 7, 8. So some books might say 9, but let's follow that there are 8 ribs. Okay, the upper 8 ribs is the origin. So what your serratus anterior muscle does is that from the anterior anterolateral aspect of your ribs, it inserts to the posterior trunk and attaches to the medial border underneath your scapula. So kumbaga naglabay siya from the anterolateral aspect, nagsuhot siya sa kay scapula posteriorly to attach to the medial border of the scapula as well as to the inferior angle of the scapula. So when your muscle moves, okay, when your origin pulls on your insertion, the movement that can occur is going to be this way, right? So its action is to draw the scapula forward along the thoracic wall. Okay, so that's in other words just scapular protraction. So let's write that down. That's scapular protraction. What else? It rotates your scapula upward. Okay, so let's talk about movements of your scapula. So here, for example, let me draw your scapula. Okay, so this is your scapula, right? We all know that the lateral aspect is with regards to your glenoid cavity or glenoid fossa. So this is lateral, and this is medial. When we're talking about rotation movements of your scapula, you can have an upward or a downward rotation movement. So when you say an upward rotation of the scapula, right, like with your serratus anterior action, this pertains to movement of your glenoid fossa going upward. So kung magpasaka si glenoid fossa or magpababaw si glenoid fossa, this movement is considered to be upward rotation of your scapula. So when talking again about rotations of the scapula, this is always with reference to the movement of the glenoid fossa. Kung diin ka point si glenoid fossa, kung pasaka, that is upward rotation. Kung panaog, that is downward rotation. Okay, so I hope you get my point. And lastly, you have your innervation of your serratus anterior muscle. So it's being innervated by your long thoracic nerve. Here's your serratus anterior muscle with origins from the upper 8 ribs. So as I've numbered, ribs 1 to 8 over here. And it goes underneath your scapula, the suot siya kay scapula posteriorly, to insert on the medial border and the inferior angle of your scapula. Okay, so when your origin pulls on your insertion, the movement that occurs is that it allows your scapula to draw forward on the cavity or on your ribs. So the next group of muscles we have are the muscles connecting the upper limb to the vertebral column. So we have your trapezius muscle, your latissimus dorsi, your levator scapulae, your rhomboids minor, and your rhomboid major. So let's start off with the biggest muscle out of all of them, or one of the biggest muscle out of all of them. You have your trapezius muscle. So your trapezius muscle is also known as the shawl muscle. So shawl bala, S-H-A-W-L. So it's something that ladies wear to keep their shoulders warm, right? So it's named so because it looks like a shawl. Okay, what else? So with your trapezius muscle, you have the origin, right, with your occipital bone. So this is the bone found on the posterior skull. It's here. What else? You have your ligamentum nuchae. So your ligaments will be discussed in the lecture, but essentially the ligament, the ligamentum nuchae is found more on the cervical aspect of the spine. What else? Especially with the cervical aspect of the spine. Then you have the spine of the 7th cervical vertebra and the spines of all the thoracic vertebra. So that's basically telling you C7, the spine of C7 and until T12. Okay, what about the insertion? So your trapezius muscle inserts on your clavicle, on your acromion, and as well as the spine of your scapula. So its action, it has 3 fibers. You have an upper fiber, which is essentially from your occiput to your insertion site. So the upper fibers of your trapezius generally elevate your scapula. So they pull the scapula upward. You also have a middle fiber. So the middle fibers coming from the thoracic region until the insertion site pull your scapula medially. And lastly, you have your your lower fibers, which pull on your scapula and pull the medial border of your scapula downward. Okay, so it pulls the medial border downward. Okay, so essentially, your lower fibers can perform downward rotation of your scapula. So that's downward rotation of the scapula. And that's it for your trapezius muscle. Additionally, you have its nerve supply, which is coming from your spinal accessory nerve, or pwede man accessory nerve, or your cranial nerve 11. So here is your trapezius muscle or your shawl muscle, right? So for its origin, you see it originating here from your occiput, where else from this white portion here stands for your ligamentum nuchae. What else? You have the spines of your C7 until the spine of the 12 thoracic vertebra. So from here, it attaches itself or it inserts itself with your clavicle anteriorly, right? What else? With your acromion process as well as with the spine of your scapula. So since it attaches from the vertebra to your clavicle to your scapula, it has movements especially concerning your scapula. So here we have the 3 fibers, your upper, middle, and lower. For the upper fibers, it's the one in green. So it allows for the trapezius to pull the scapula upwards, causing scapular elevation. You also have the middle fibers within your thoracic region, within the spines of your thoracic area. So it can pull, this one in blue, right? It can pull your scapula inwardly or medially, causing scapular retraction. So again, that's scapular elevation, scapular retraction. And lastly, the lower fibers, the ones in yellow, can pull on the medial border of the scapula inferiorly or downward, causing downward scapular rotation. Downward, let's just put downward rotation. The next muscle we have is your latissimus dorsi. So this is the broad muscle, latissimus, broad muscle dorsi, found on the posterior aspect or the dorsum of the body, right? So this is a picture of your latissimus dorsi, or some would like to call it as your lats. So your latissimus dorsi has what you call as a wide array of origin. So it originates from the spinous processes of the T7 to the L5 vertebra. It has origins with the iliac crest, which is this point here, the highest point of your ilium, or with your pelvis. It has origins with the sacrum bone. Where else? It has origins with your thoracolumbar fascia. So the thoracolumbar fascia is a piece of fascia found on the thoracic area towards the lumbar area, posteriorly. What else? You have origins with the inferior angle of the scapula. So it's here, as you can see, it's covered with the muscle already. And lastly, it has origins with the lower 3 or 4 ribs. So all of these are just the origin of your latissimus dorsi. So very broad gid ang iyang origins. Next, you have its insertion. So it inserts on the bicipital groove of the humerus. So the bicipital groove is another name for your intertubercular groove or your intertubercular sulcus, which is found between your greater and your lesser tubercles or tuberosities, right? So from the posterior aspect, what your latissimus dorsi does is that it what you call this, it inserts within your axilla to get to your bicipital groove. Okay, so from posterior aspect, it crosses your axilla to get to the anterior aspect of your bicipital groove. So the action of the latissimus dorsi muscle include extension, so pulling the humerus backwards, extension of the shoulder joint, adduction as well. It can adduct your shoulder joint. What else? And medial rotation. So that's medial rotation. This is your latissimus dorsi, and this is being innervated by your thoracodorsal nerve. So next we have your latissimus dorsi. Your latissimus dorsi has origins with the spinous processes of T7 to L5. So as I've marked here, this is T7, this is L5. It also has origins with your sacrum bone, with your iliac crest over here. Where else? With your inferior angle of the scapula, and with your lower 3 or 4 ribs. So it's here. So all of these are just the origins of your latissimus dorsi. For its insertion site, as you can see here, your entire latissimus dorsi muscle inserts within the bicipital groove of the humerus, which is found on the anterior aspect. So as of now, this is posterior aspect, meaning para si latissimus dorsi can get to its insertion site, it has to cross the axilla or your underarm area and insert anterolaterally to your bicipital groove or to your intertubercular groove or sulcus. Okay, so for the actions of your latissimus dorsi, this can be summarized by the word exadir. So just remember the word exadir for the actions of your latissimus dorsi. So exadir means extension of the shoulder joint, adduction of the shoulder joint, and internal rotation of the shoulder joint. So all of these again are actions of the latissimus dorsi muscle. So that's extension. What else? You have adduction, and lastly you have internal rotation. Okay, so this is your latissimus dorsi muscle, and this is being innervated by your thoracodorsal nerve. Next, you have your levator scapulae muscle. So your levator scapulae, from its name, it's named for its action. It can elevate your scapula. So it has origins with the transverse processes of the first 4 cervical vertebrae. So generally speaking, that's from C1 to C4. What else? You have its insertion within the medial border of the scapula, and its nerve supply is your dorsal scapular nerve, and its action, of course, is to elevate your scapula and to raise the medial border of the scapula. So this is your levator scapulae. So this is your levator scapulae muscle with origins on the transverse processes specifically of C1 to C4, as I've marked here, and it inserts itself on the medial border of the scapula. So just a bit at the superior aspect of the medial border. So this is your levator scapulae muscle. For the action of your levator scapulae muscle, so it can pull on the scapula upwards, causing scapular elevation, as the name suggests, levator scapulae. And another action is to raise the medial border of the scapula. So it can raise the medial border of the scapula. So it would look like this. So raising the medial border of the scapula will actually cause your downward rotation of the scapula. Because again, when we're talking about rotation of the scapula, that is pertaining to your glenoid, fossa, or cavity. So if you can imagine, if your levator scapulae pulls on the medial border to elevate it, right? The movement, ma-elevate si medial border, but si glenoid fossa, di ba, manaog na siya. So that's why raising the medial border is equal to a movement of downward rotation of the scapula, because the glenoid fossa will now be facing downwards. So that is your levator scapulae muscle. It is being innervated by your dorsal scapular nerve. Next, you have your rhomboid minor. So this is named after its shape. So it's a bit of a rhombus shape. So for the rhomboid minor origin, so it originates from the ligamentum nuchae. So this is again a ligament found on the cervical area of your spine, right? So it's from the ligamentum nuchae and the spines of C7 to T1, as I've marked here. So spines of C7, T1, and a bit of your ligamentum nuchae. It inserts itself on the medial border of the scapula. So just below kung di nag-insert si levator scapulae kagina. Okay? So wala sila gaagaway place. They each have their own place within the scapula. What else? About your rhomboid minor, its action would be now to elevate the medial border of the scapula. Okay? So it's the same thing as sa kay levator scap kagina. It can elevate the medial border. And when the medial border is elevated again, di ba, si glenoid fossa, manaog na siya, causing a movement of downward rotation. Okay? So again, when the medial border is raised up, the lateral border goes down, causing the same movement, which is downward rotation of the scapula. Okay, your rhomboid minor is being innervated by your dorsal scapular nerve. So the next muscle we have is your rhomboid major. So as the name suggests, it's a bit rhombus in shape or rhomboid in shape, and it's major because it's bigger than your rhomboid minor. So for the origin, you have the thoracic spines, especially your T2 to T5 spines. So never mind my markings because I accidentally added an extra one. But anyway, that's your T2, T3, T4, and T5 spines. And it inserts itself on the medial border of your scapula. So again, wala sila gaagaway place ni rhomboid minor and elevator scap. They each have their own place within the medial border. So this is your rhomboid major muscle. This is its entire, what it looks like, or its entire length. And its action will be the same as a rhomboid minor mostly, which is for pulling of the medial border upward and medially. Okay, so in other words, it can also downwardly rotate the scapula. Okay, so your rhomboid minor and major, more or less the same action, which is downward rotation of the scapula. For your rhomboid major, it's being innervated by your dorsal scapular nerve. For our next set of muscles, we have muscles connecting the scapula to the humerus. So you have your deltoid, your supraspinatus, infraspinatus, teres minor, your subscapularis, and your teres major muscle, and sometimes included is your coracobrachialis muscle. So for the muscles found on this list, there's actually another collective term for some of the muscles here. Specifically, that's with your supraspinatus, infraspinatus, teres minor, and your subscapularis muscles. So they're called our sits muscle, standing for the first letter of each of their names, or what's better known and famously known as your rotator cuff muscle. Rotator cuff. So they're called the rotator cuff muscles because they have the ability to rotate your shoulder joint, or to rotate specifically your humerus. So they are largely, they are largely external rotators with one internal rotator among them. So more on that later on as we go through with the muscles found on this list. So the next muscle we have on our list is your deltoid muscle. Deltoid. So your deltoid muscle makes up a large bulk of the muscles found on your lateral shoulder. Okay, so for the origins of your deltoid, it has origins with the lateral third of your clavicle. It has origins with your acromion process and with the spine of your scapula. So when you take a look at your deltoid, may origin siya kay anterior girdle, shoulder girdle, as well as the kay posterior girdle. So for the insertion site of the deltoid muscle, we have here a specific point in our humerus known as your deltoid tuberosity. So si deltoid tuberosity, if you remember, is found on the lateral aspect of the proximal shaft of your humerus. So specifically para kay deltoid muscle. Now your deltoid muscle actually has three fibers. You have an anterior fiber here, marked by the black ink. You have the middle fiber, marked by the blue ink. And lastly, you have your posterior fiber marked by the yellow and the green ink. So each of them has specific functions. But generally, when you're talking about the deltoid, it's majority shoulder abductor. Okay? Because halin siya sa anterior and lateral aspects of your shoulder girdle, and ma-insert siya kay lateral aspect ni humerus. So na-cross niya si shoulder joint, allowing for a great degree of abduction to occur. Okay? So yeah, a greater degree of movement is your abduction. But to be specific, it has three fibers, right? So the anterior fiber allows for shoulder flexion. Okay? It allows for shoulder flexion and medial rotation of the humerus. So the anterior is for flexion, and medial rotation or internal rotation. See, middle fibers, they're more focused on the action of shoulder abduction itself. So shoulder abduction, middle fibers. And lastly, si posterior fibers. So diba may origin si deltoid kay spine of the scapula as well as kay acromion, right? So it can extend the shoulder as well as externally rotate the arm. Okay? So si deltoid has a lot of actions. It can flex and internally rotate the shoulder with the anterior fibers. It can abduct with the middle fibers, and it can extend and externally rotate the shoulder with its posterior fibers. And your deltoid is being innervated by your axillary nerve. The next muscle we have is your supraspinatus, which is one of the rotator cuff muscles. So your supraspinatus originates with your supraspinous fossa. So this is the fossa found above the scapula, and it inserts itself on the greater tuberosity. So from its origin kay supraspinous fossa, it goes anteriorly to get to your greater tuberosity. Okay, so its action is to abduct the arm and to stabilize the shoulder joint. So action ni supraspinatus to stabilize how? By keeping the humeral head within the glenoid fossa. Okay, so kumbaga ginabuligan niya si glenoid fossa to fit in, ginabuligan niya si humeral head to fit in better with the glenoid fossa. Okay, to allow more leverage for shoulder abduction to occur. And also, about your supraspinatus, remember, si deltoid is a great abductor. Okay, but it can't be great without your supraspinatus. So they work hand in hand together. Your supraspinatus is actually the initiator. Sorry, the initiator, or it initiates, or it starts. Let's just put in the initiator. Okay, so it initiates or it starts abduction. So kumbaga, when you try to abduct your arm, the first certain degrees, like let's say 0 to 15, the first 15 degrees or so is actually the work of the supraspinatus. And the rest of the abduction until 180 degrees, when you're able to raise your hands up, is actually the work of your deltoid muscle. Okay? So without your supraspinatus, there can be no initiation of shoulder abduction. Okay? So for example, in patients na may what you call this, may rupture of the supraspinatus muscle, they can't initiate abduction. So you know that supraspinatus is the problem if they can't initiate, but if you help them along passively, ikaw ma-raise ang ilang shoulder, they can raise their arm, and you can raise their arms, for example, at a 90-degree angle. You find nga kaya gali nila to reach 180 degrees on their own, but only starting from 90 degrees. Okay, so nadula si initiator, but the bulk of the action can still be done by your deltoid muscle. So again, important si supraspinatus for stabilization of the humerus against the glenoid fossa, as well as initiate abduction. Okay, so that is your supraspinatus muscle. It can abduct the arm and stabilize your shoulder joint. So that's its big functions, and it's being supplied by your suprascapular nerve. So remember, sa kay scapula, you have your suprascapular fossa. So your suprascapular nerve is the one nerve that passes through there to innervate your supraspinatus muscle. Okay, so I hope you can connect all of these certain bony landmarks to the muscles and especially to the nerves and the actions itself. The next muscle we have is your infraspinatus. So your infraspinatus is a muscle that originates with your infraspinous fossa, which is found on the posterior scapula, and it inserts itself on the greater tuberosity. So unlike na supraspinatus na it passes through anteriorly to get to the greater tuberosity, your infraspinatus passes posteriorly and mag-go siya anteriorly a bit to insert itself on the greater tuberosity. So this is your infraspinatus. So the infraspinatus action is to laterally rotate the arm. Okay? So it can externally rotate the arm this way, as well as to stabilize the shoulder joint. Your infraspinatus muscle is being innervated by your suprascapular nerve as well. Okay, so duwa na sila ni supraspinatus. And also, when we're talking about the rotator cuff, you'd find out that most of them are actually inserted on the greater tuberosity, and most of them are actually lateral rotators. But more on that later on. So for now, this is your infraspinatus muscle. The next muscle we have is your teres minor, which is also part of your sits muscle or your rotator cuff muscle. So as you can see, it has origins with the upper 2/3 of the lateral border of the scapula. So you can say lateral border, that's fine. But to be specific, it's more on the lateral upper third of the lateral border, okay? And it inserts on the greater tuberosity as well. So do you see a pattern? Your sits muscle generally have insertions with the greater tuberosity. And since it's from the posterior scapula up until the greater tuberosity, one of its actions, again, will be to laterally rotate the arm. So that's external rotation of the arm or the shoulder. And aside from this, your teres minor also has the ability to do shoulder adduction because of its orientation. Okay, so these are the two major actions of your teres minor muscles. Your teres minor is being innervated by the axillary nerve. So the same sila innervation ni deltoids. Okay, so this is just so you'd have an easy way of remembering them. So you can group them in terms of their innervations or in terms of their common insertion or origin sites. So next we have the last muscle of your sits muscle or your rotator cuff muscle. It's your subscapularis muscle. So let's write it down. You have your sub. So let's shorten it to subscap. So this is your subscapularis muscle. So with your subscapularis muscle, the origin is in your subscapular fossa. So it's this part here on the anterior scapula. So kung diin nga part ga-attach kay thorax, that is the anterior scapula, it contains your subscapular fossa. Okay, what else? So it inserts this time on the lesser tuberosity of the humerus. So from the anterior scapula, it attaches on the lesser tuberosity of the humerus. Okay, so sa sits muscle ta or sa rotator cuff, your subscapularis is the only one that inserts on the lesser tuberosity. So what about the action of your subscapularis muscle? Your subscapularis muscle can actually do this time internal rotation. Okay, internal rotation. So si subscapularis is a rotator cuff muscle, but this time suli iya insertion are siya kay lesser, and the action is to medially or internally rotate the arm and not external just like the other ones. Okay, so lain si subscap, but it's still part of your rotator cuff muscle. Okay, so what else? It also has some contribution to stabilizing your shoulder joint. For its innervation, it's being innervated by your upper and lower subscapular nerves. The next muscle we have is your teres major. So this is actually one of the last muscles of this group. So your teres major has origin with the lower third of the lateral border of the scapula. So, hindi man sila again mag-agaway place ng teres minor, even though they're both found on the lateral border of the scapula, they each have their own place. So, si teres minor, kagina, is more on the upper half of the lateral border. This time, si teres major is found on the lower half of the lateral border. So, it originates here, and it inserts itself on the medial lip of the bicipital groove of the humerus. Okay, so remember, kagina, we've talked about the lips of the bicipital groove, right? So, ang lips are just merely the borders of the bicipital or intertubercular groove. With the lateral lip, you had your pectoralis major attaching to it or inserting to it. Right? This time, kay medial border, or sorry, kay medial lip is your teres major. And question, do you remember which muscle inserts itself within the bicipital groove mismo? Right? So that muscle is your latissimus dorsi. So one way to remember that is, let's try to draw it here. Okay, so this is your medial lip, this is your lateral lip, and this is your groove. So with the medial lip, what inserts here is your teres major. Let's just put T maj to make it short. T maj. Okay, and with your lateral lip, what inserts here is your pectoralis major. So let's just put P maj. And what inserts on your, what you call this, on your bicipital groove is your latissimus dorsi. So let's just put lats. So I hope that's visible. That's your latissimus dorsi. Let's try it with another. So what inserts on the bicipital groove is your latissimus dorsi. Okay, so one way to remember that is that within this part of the humerus, there are two majors, there is one lady, that's your lats, that there's one lady sitting in between two majors. So one lady sitting in between two majors, that's your latissimus dorsi, on the bicipital groove, sitting in between two majors. One major, teres major, is on the medial lip, and one other major is on the lateral lip, which is your pectoralis major. Okay, so anyway, that's just a bit of a mnemonic to help you remember. Let's proceed anyway with your teres major. Oh no. So what else about your teres major aside from its origin and its insertion? So you also have the action of your teres major. So your teres major's action, based on its orientation, is again to be able to medially rotate the shoulder. So that's internal rotation. That's internal rotation. Okay? And you also have adduction as well. And it also allows for stabilization of your shoulder joint. So this is your teres major, and this is being innervated by your lower subscapular nerve. So the last group that we're going to discuss today is about the muscles of the arm. So we have your biceps brachii, your coracobrachialis, which can be again part of the other group, which was connecting the upper limb to the scapula, right? You also have your brachialis muscle and your triceps brachii. Okay, so first off, we have your biceps brachii. So biceps, it has two heads, and brachii, it's part of your brachium or arm bone, right? So for the origins, you have two heads of your biceps. You have a short head and a long head. So your short head is being depicted by your color blue here. So this is your short head. Your short head originates from your coracoid process of the scapula. Okay, this is the origin of the short head. You also have your long head, which is depicted in red. So for the long head, it's originating from your supraglenoid tubercle. So remember, within your scapula, you have your glenoid cavity. Above it is your supraglenoid tubercle. So this is the origin of your biceps brachii muscle. So from the supraglenoid tubercle, it crosses on the humeral head and crosses your bicipital groove. Okay, so again, amo ni siya nga agi natawag siya bicipital groove, which is another name for your intertubercular groove because the tendon of the long head of the biceps passes through your intertubercular groove. So this is your long head. Okay? So both the long head and the short head of the biceps will have the same insertion site, which is at the forearm. So specifically, the insertion is with your radial tuberosity of the forearm. Okay? And also a bit of the bicipital aponeurosis into the deep fascia of the forearm. So it has specific bony articulation or bony insertion with the radial tuberosity, and it also has a bit of insertion with the fascia found in between your radius and your ulna. Okay, so this is for your biceps brachii muscle. The action of the biceps brachii muscle, since it crosses, diba, you can see it crosses your elbow joint, so it can allow elbow flexion. What else? It crosses your shoulder joint. It can allow a bit of shoulder flexion, but not as strong, okay? Very weak, but it can contribute to shoulder flexion. What else aside from elbow and shoulder flexion? Your biceps brachii is actually, very surprisingly, a very strong forearm supinator, okay? Very strong forearm supinator. So when you want to test the maximum strength of the biceps brachii, it's usually with your forearm supinated and with your elbow flexed, okay? So amo na siya ang pinaka-strongest position for your biceps. It's a very strong supinator and an elbow flexor, but it's a weak shoulder flexor. Okay, so that's just about your biceps brachii. And lastly, it's being innervated by your musculocutaneous nerve. The next muscle we have is your coracobrachialis muscle. So this is a muscle being named for its origin and for its insertion. So very easy to remember. So you have your coracobrachialis muscle. So it originates with your coracoid process of the scapula here, and it inserts on the brachialis or on the brachium. So it inserts itself on the humerus. Okay, so halin kay scapula up until the humerus. So that's, to be specific, it's on the medial aspect of the shaft of the humerus. Okay, so this is your coracobrachialis muscle. So as you can see, it crosses your shoulder joint. Okay, so it can allow movement within your shoulder joint. So it allows a weak amount of flexion, shoulder flexion to occur, as well as shoulder adduction. Okay, so pada siya shoulder flexion and a weak adduction. Okay, so this is your coracobrachialis. It's also being innervated by your musculocutaneous nerve. So the same sila innervation ni biceps brachii. The next muscle we have is your brachialis muscle. So from the name itself, we know that it's found on the arm, specifically your humerus. So your brachialis muscle has origins with the anterior lower half of the humerus. So nothing or nowhere specific, just usually on the anterior lower half of the humerus. Okay, that's its origin. And it inserts itself on the coronoid process of the ulna. Okay, so remember the coronoid process of the ulna. If this were your ulna, this would be your coronoid process. Okay, so you get inserts yung brachialis muscle. This time, your brachialis comes from the mid-humerus up until your ulna. So it crosses not your shoulder joint, but this time your elbow joint, allowing your brachialis to move your elbow joint. So for the brachialis muscle, its action is that it's solely or it's only a elbow or an elbow flexor. Si brachialis is just an elbow flexor. Okay, its innervation for the brachialis muscle is your musculocutaneous nerve. So again, for musculocutaneous, we already have three muscles. That's your biceps, your coracobrachialis, and also your brachialis muscle. So lastly, we have the last muscle we have on our list that attaches to your arm or to or basically your arm muscles. You have your triceps brachii. So your triceps brachii is found opposite your biceps brachii. So it's found posteriorly. So from our previous discussion about your or about the naming of the muscles, we have your triceps brachii. So from the name itself, we can tell that it has three bellies. It has three heads. Your triceps brachii has three heads, and that it's part of your brachium or your arm. Okay, so for the three heads of your triceps, so they each have their own specific origins. So for your long head, so your long head is being represented by your color red here, color red line. So this is your this is your origin of your long head, which is specifically your infraglenoid tubercle. So remember, kagina, sino yung gani ang originate kay supraglenoid? Diba it was your biceps? So this time, you have your triceps originating on your infraglenoid tubercle. To be specific, it's your long head of the triceps. Okay, so si long head is color red. Next, you have your lateral head. So your lateral head is from the upper half of the posterior shaft of the humerus. So this is being represented by the color blue. So this is lateral head, this one here. Upper half of the posterior shaft. And lastly, you have your medial head. So wala ta color green, let's just use the color black. So the medial head is here, represented in black and green. So usually, class, see triceps medial head, this is being covered by your long and your lateral head. So hindi siya kitaon posteriorly. But for, what you call this, for discussion's sake, so let's leave it open. So para lang makita ta si medial head. So anyway, they each have their own origins. Again, the long head is from the infraglenoid tubercle. The lateral head is from the upper posterior shaft of the humerus. And the medial head is from the lower posterior shaft of the humerus. So since this is one muscle, it has the same insertion site, and that's with your olecranon process of the ulna. So remember, the olecranon is found on the posterior ulna as well, right? So your triceps brachii crosses the elbow joint, therefore it can act on the elbow joint. Ang action specifically ni triceps brachii with all of these heads is one singular action, which is elbow extension. Okay, so the action of the triceps brachii is elbow extension only. And what else? Your triceps brachii is being innervated by your radial nerve. So this is it for your triceps brachii muscle. And that's it for our discussion today. I hope you learned a lot. Thank you for listening.